All right, guys. We have Niralee on the line today for the last 10 minutes of this call. We do it pretty frequently, but we kind of did not do last month. I'm going to have few students who got jobs through us and who did the course and who kind of settled into their first pharmacovigilance job. And as a matter of fact, there's someone who is in PV for last 7 years. She did the course in 2000. I believe 16 or 17, she got promoted. She called me to let me know, and she's actually coming on the call next week or the following week. So you're going to also hear from her how she was able to do her career transitions. She's almost almost eighth year in her career. She had got 2 promotions, and how did she do? So you're going to have a flavor of all these folks. So the reason why I have Niralee on the call is she recently got placed. She started her job. She's very new to PV, probably 3-4 months ahead of you in kind of doing this course and all those things. So I want her to like kind of talk to you about her story, what challenges she had, how the interview went, how did she prepare, anything that, I mean, from her education to what she's doing right now. It's pretty much an open call. The only 2 questions you cannot ask, common sense, is don't ask her pay, because one of you should not be depressed. Second thing is don't ask her about the client, because the company that she's working, because this is a recorded call and it goes on, YouTube and whatnot. So I don't want a client's name or the company's name. So those are the 2 questions, but the rest of it is open for anyone to ask questions after she shares her story. Niralee, all yours. Start with education. So
okay. Thank you. Hi guys. Sorry I'm not on video today. I just had a skin reaction. So
you reported.
Yeah, I might. Yeah. So, and because I have been postponing the call for some time, so I didn't want to delay it anymore. So I am a registered pharmacist by profession. Before I did training with MediPharm, I was working as a retail pharmacist with a couple of retail chains for about 15 years. So I did my training with MediPharm starting in December 2021 and finished it around sometime in March. And then, so I didn't like immediately start applying, just like a personal situation, and in combination with I wasn't mentally ready for applying and stuff like that. So I just took my time. So I didn't start applying until end of January of this year. So almost like 8-9 months later, after I finished the training with MediPharm, I started applying in January, end of January, February. Which then I think I applied for about 20-25 jobs. I was able to get 2 interviews. First one did not work. The second one clicked, and that's where I'm working right now. Yep, I think that's my story.
Short and sweet, as usual.
Yeah, you missed some part of it, so.
I missed it. Oh, okay. Any questions to her?
Hi, Niralee. Thank you so much for coming on call and sharing your story with us. Can you tell us a little about the interview process? What do you think did not work or did not go well in the first interview?
I would say I probably I wasn't prepared enough for that interview. So the interview process depends on like each company. It's different. The first one was I had the first round with the director of the department and the hiring manager. It went on about for 30 minutes, and then they gave me the assessment, which I was supposed to submit in 30 minutes. I thought I did the interview pretty well, but the assessment I wasn't like really confident about. But I just took it as a learning experience, I would say. And then the second interview, it was like, compared to the first one, it was pretty easy. Like they just asked me very basic questions. And it was a very short interview, like introduction and very basic questions. And yeah, so that worked actually.
So in the first interview, when you talked about assessment, was it technical questions like the subject matter that we are studying in this
No,
PV course?
they actually give you a source document, and they want you to write a narrative and put in some queries. Like what queries would you ask based on the source document they give you?
Okay. And do
That's
you
what you have
think
to-
I'm sorry, I'm cutting you.
No,
Do you
that's
think your pharmacist experience
Mhm.
that you had like 15 years experience, it helped in your selection process? I'm asking only because I don't have such elaborate experience.
Oh, I don't think it matters as much as long as you are thorough with your pharmacovigilance training and thorough with the subject, I guess. It definitely helps while you're actually working, but no, it doesn't make a difference in getting a job. No. It's a plus, yeah, definitely it's a plus, but it's not a deciding factor to get a job, no.
And when you started applying, were you applying for like basic entry level jobs like data entry and triage type jobs?
No, like anything that would match like my profile, I was applying like wherever there was opening, like through all the website, LinkedIn, Indeed, and mostly it was through LinkedIn. And then the recruiters reach out to you, you reach out to the recruiters. So no, it wasn't like, I mean, it also depends on you. How comfortable are you in your first job? Like, how do you want to start it? If you are confident enough to start at a like higher level, higher position job, yeah, you can do that. But I personally felt, because I didn't have like any PV experience, just training at MediPharm, I felt more comfortable starting from a more entry-level job.
All right. Thank you so much. Thank you.
Sure.
Hi, Niralee. Congratulations.
Thank you.
I have two questions for you. You may have touched on them a little bit,
Mhm.
but do you think you would have gotten this job without going through MediPharm Solutions?
No.
Thank you. And the next question I want to ask you is, what is your job title, if you don't mind?
Sure. It's case management specialist.
Okay. Thank you.
Sure.
Hi, Niralee.
Let me ask you. I'm sorry. So, congratulations again.
Thank you.
So good. As a case management specialist, what do you do?
So I am responsible for the triage and actual process, like data entry. Those are the two steps in the end-to-end case processing. Those are the two steps that I'm working on currently.
Okay, the first phase of it, right? Knowing the seriousness and also entering it down.
Yes, so triage and data entry, yes.
And data entry, okay.
So the first step is intake, the case booking. Then it goes to triage, then data entry, and then we forward it to the QCer.
With the QC and the medical review, right?
Correct, and then finally report finalization and submissions, yeah.
On submission, okay. Thank you so much.
Hi, Niralee.
Hi,
So
Sushi.
I have one question. So at the nature of job as you described, so are you involved in all these steps as a case management specialist?
No, I'm not. Right now, it's only triage and data entry. The data entry part is called the case management step. So there's it also depends on, like, every company is different. They have their own workflows in it. So currently where I am, this is a workflow. There is a separate intake team. Then the case comes to one of us for a triage, and then we do case management at the same time, and then finally we send it to QC and then the further steps. Yeah. But yeah, so there is a separate team for a QC for submissions and everything, but it could be different with different companies. So yeah.
Okay.
I have two more questions. They're pretty short. So what is your job like? Is it a remote job, or do you have to go to an office?
It's remote, completely remote.
Completely remote. And how much is the workload? Are you able to easily finish whatever task you're given in one day, or do you have to go extra hour or so to finish it, or is it pretty lax?
So currently I'm still in the training period. I'm not independent yet. So we are not assigned as many cases as we would be probably when we are independent. But as of now, no, it's not that bad, and we are not like pressured as much. And it's totally your call. If you feel that if you want to finish it, and if you're not able to finish it within the work hours, you can always like log in and finish your work. So that's not a like, yeah. But it's not bad. It's not. I'm working on clinical trials currently, so they are a little. They take a little longer versus the post marketing. But yeah.
All right. Thank you. Thank you so much.
Sure.
Hi, I have one question.
Yes.
Hello.
Hi.
With your job, is it location restricted? I know it's remote, but is
No,
it
it's
something
not.
like you have to stay? Okay, so you can work anywhere in the country or in the world, or it doesn't matter?
Correct. In the world, I'm not sure, but within US, anywhere is fine.
Thank you.
Yeah, so I have one more question.
Yes.
So you said you applied for a number of jobs, and so can you give a few examples as to what are the job titles, like the names of the positions?
Again,
Just a few, for example.
Sure. So right now I'm working as a case management specialist. The one before that I interviewed for, I think that was a product safety specialist.
Niralee, unmute yourself.
Okay.
Yeah. Go ahead, please.
Yes, I was saying like don't like probably base your decision on the title. Look at the job description. That's more relevant because like I said, currently I'm working as a case management specialist. The one before I interviewed for was a product safety specialist. I think the job description was pretty much the same. So it's more about the job description versus the title, because every company would have a different title for the same job. So yeah.
Okay.
Yeah, it could be drug safety associate, drug safety specialist, like case management specialist. Yeah.
Niralee, congratulations. I have a question.
Yep,
Do you find this job fairly challenging, or do you think it's something that?
No, yeah, it is challenging, and personally, it's interesting also. Like every case, I learned something new, and yeah, I feel it like it's very interesting. I enjoy doing what I'm doing right now. Yeah.
Thank you.
Sure.
And do you work remotely?
Yes, I work remotely.
Hi, Niralee. Congratulations.
Thank you, Kranti.
I have a question. So when you when you land the job, how many months it took for the preparation?
Preparation, like I said, I started applying in January. You mean like before start to applying, or like
No, just like how much is the
after you land?
Yeah.
Okay, so after you get the job, the training period at work, it also varies with companies, I guess. So I started 1st June of this year, and then I'm still, like I said, I'm still in the training phase. So it depends.
Okay. So do you think like the MediPharm Solutions helped you a lot for the interview prep, or
yes, absolutely.
Absolutely. Okay, that's good to know. Thank you.
Sure. Like even
One
with
more
a gap of
question.
8-9 months, like Dr. Abhishek was really responsive. Even after a gap of 8-9 months, I reached out.
Irresponsive or responsive?
Responsive. Very responsive.
That's good to know.
No, of course, yeah. He takes time.
Check is in the mail. Do all the things.
Yeah, he'll take his time, but he will respond. But yeah, bug him until he responds. So that's a tip.
That's good to know.
Keep bugging him. Yeah. But he will reply eventually. He will respond, but you'll have to be patient with him. That's it.
Hi again, Niralee. How long was your interview? Was it one interview or multiple interviews? And how long? Like an hour?
I was lucky with the one that I landed job with. It was only one round of interview, and it was about 20 minutes. That's it. So the second interview was pretty easy. Like I said, I got lucky. Yeah, the first one was a little overwhelming for me, I think, because it was my first interview, I guess. So, and with the assessment and everything. So. But yeah, I just got lucky with the second one. Yeah, I guess. But the thing is, like, yeah, just be like very thorough with your subject. Yeah, as long as you know your basics, you should be good. Because until you actually start working, I mean, you're not able to, like, I joined the call a few minutes ago and I was listening to everyone's questions. So yeah, like once you start working, all those questions and everything will be like much more clear, I guess. So just like stick to the basics for now. As long as
Awesome.
your
Thank you.
subject and fundamentals are clear, you should be good.
I have one question. You used to be a pharmacist, is
Yeah.
that right?
Mhm.
Would you ever go back to pharmacy?
That's a good question. No. Only the reason being for like work balance, like, I mean, yeah, work-life balance.
Work-life balance?
Yeah.
Okay, thank you.
Sure. Yeah.
All right, guys. No questions. Thank you, Nirali, in the first place.
And then if I may mention, Dr. Abhishek,
Sure, please.
in future classes, I can volunteer to come in and like explain in detail the whole process. If anyone wants to know, I think that might give them a better picture of what they should be expecting at the work.
Yeah, please do. I really appreciate that.
Yeah. So whenever you guys are ready, or like whenever Dr. Abhishek wants me to, but yeah.
No. I mean, like, see, the point is, it's not just you. There are other folks who can also do what it is. Everyone should be exposed to everyone who can contribute. You have seen this happen when you did the course, when you did it 2021.
Yep.
Whenever you did it, I'm sure there are n number of people who came in just like you.
Yep.
And they did the same thing. You're just repeating the same what they kind of went through. And only thing is, your story is unique because it's your story.
Yep, exactly.
So that's all it is. So I have nothing to say other than what Nirali just alluded to. Like, I think the basics of pharmacovigilance, what we teach, the reason why we have core modules for new folks and folks on the call, we call them core modules for a reason, because in the heat of the moment, and tomorrow is your interview and you don't know what to do. Sometimes some people are anxious. You will definitely have that jitters, before your interview. You got to be very thorough with your core modules. That's number one. Number two, why people do not get jobs in PV, irrespective of your education, and why people, why people don't get jobs in pharmacovigilance. Like how Nirali said, she's actually, I should not say lucky. I think she was preparing herself more than required. That's why she took some time, and that's okay. Because see, the point is, you cross the line, you cross the finish line, you're done. There's not much I need to do with Nirali. So that's where I always say that the weakest link is as strong as the strongest link. So that's pretty much what Nirali, and I was actually able to work with her in doing this. So the second thing, apart from the core modules, why people don't get jobs in PV is lack of patience. They don't apply for jobs. That's a very simple, but that is what I've seen most students do. They go through this yo-yo cycle. They get an interview, they get excited, they're nervous, they do all those emotions, and once the result not go their way, they go down. They're not depressed, they're not out, but they don't do any action. They go down and they stay there for like a couple of months, and then for whatever reason they get a second interview, they again surface. It's useless waste of time, and you kind of spend a lot of energy in this cycle. It's rather than that, just take a good 3 months, 4 months burst of action, apply to as many jobs as possible without any filters, get to the first interview, without thinking, without, a lot of people over analyze, but they don't do any action. They kind of analyze a lot, and you cannot analyze if you don't take action. So I always say in the interview prep call, towards the end of the course, all of you will have that interview prep calls. We started doing that this year. So it's not only for folks who are in interviews and stuff, but as a continuation of all the modules and core modules, we'll have 2 classes at the end of every batch where we'll transition into interview prep. And the reason why we want to do that is the 50% of the course is done in these modules. And this is how I can summarize that. 50% of the course is done in these modules, in the 24 classes that you take, 12 weeks, 24 classes, 24 topics, 50% is done. But the last 2 interview prep calls that we do is actually 50%. That's how important those 2 are, because this, I have not heard a subject, sorry, I have not heard a student say, I did not get the job because I don't know the subject. The subject is already there with you. It's not rocket science. You guys have done more than required education, I should say, to understand this. Maybe it will not make sense to you right now, but at some point during the course, it will make sense for sure. So the subject is not the thing. It's all about what happens in the 2 interview calls, and we do it not 1 hour. It's almost like 2 hours each. So it's like 4 classes into the 2 sessions. So once you go through that classes, and we want to do it live, I can record it, I can give it to you, but I really refrain from doing that, is because then we don't know where the current students are. You know, some of you are anxious, some of you are prepared, some of you are not at all prepared. So we want to know where you guys are standing, like what is happening with you, how long do you take, and then the game is yours. After those 2 classes, the whole game is yours. You need to play it, because you have to apply for jobs. And as I said, people don't get jobs in PV, even the sharpest and the finest ones, because they want results yesterday. And that is the reason why they don't, they get frustrated, they get disappointed. Oh, I did everything in this interview, what can go wrong? You have no clue what can go wrong on the other side of the picture. On the other side, the company might have a hiring freeze right after the interview, or maybe they found a candidate who is willing to work for half the price that you are going for. We don't understand all these dollar signs right away. So there are so many variables that you may not know in the whole supply chain, that can come to the surface in an email saying that we went with other candidate. They'll not give you a reason even. So you don't take that rejections personal. And some people have stomach for it, some people don't. And people who, I mean, like I got rejected many times. I can show you my spreadsheet of my recent job that I did in 2020 when I transitioned into this current role. I went through what you guys will be going through. Like I had to literally, it's a sales funnel. You know, if you have like 10 face-to-face interviews, I mean, 10 phone screens, you'll have 5 face-to-face interviews. You get 2 job offers, and you pick the best of the job offer. This 10-5-2 has never gone wrong in my career in 10 years. I've done 4 transitions, and there are days when I felt like this is not going to work. And there are also students, like if you hear to, I can recall a student by name Prashant. He's a PhD candidate, and he always said, Doc, I'm not getting anything. I'm not getting anything. Every time he used to call me, that's his statement. I'm not getting anything. I'm not getting anything. And one day he went from this problem, or this challenge, I should say, to a new challenge. He said, Doc, I got 3 offers today. What should I do? So my question is it worth doing all this if you are like, you know, disappointed, unhappy all the time and trying to get a result? It's okay to kind of be happy, be positive, and kind of do the process, because the result is guaranteed if you're willing to put the work required. And I believe at some point I also thought, why am I motivating? Why am I doing this if they're not going to be taking action? But I thought, if there is one more Niralee, if there is one more, you know, Prashant, it all makes sense to me by the end of the day. And this is not part of the course. This is not part of, you know, PV, but it is part of your life. And that is more important than just doing PV or pharmacovigilance. So that is the reason why we do what we do. And again, I know it's over the hour, almost 20 minutes over 8. So I thank you, Niralee, for coming on the call in a short notice. I know you're not 100%, or else you'd be on video, I know.
Yes,
So
yes.
we'll call you some other time. You can take all the time that you need. But thank you again. And guys, I'll see you guys on Thursday.
Excuse me, doctor.
Yes.
When you were teaching the last slide, is it part of next class?
Yeah, we're going to continue that on Thursday.
All right, thank you.
Yeah, on Thursday, we'll have one more student, exactly like Niralee. I believe, if I'm not wrong, he is also a pharmacist. His name is Chinedu. He's a good student from almost 2021. He got a job, got laid off, again got a job. So you'll hear his story as well. Thank you, guys.
All right, thank you.
Good luck, guys. Yeah.
Yeah.
Thank you.
Thank you.
Bye-bye.
Bye.
Bye.